Thanks so much for having me. I wanted to talk a little bit about sort of an array of food activities that are going on at Pew, because I know many of you may have heard dribs and drabs about what we're up to. And I'm going to focus most heavily on the food additive issue, which is something that we're very actively working with ILSI on and with a variety of folks in industry and the nonprofit community. Our basic approach to food issues is to focus on science-based policies. We are now a policy shop. Many of you may think of Pew because you've heard of us on National Public Radio or elsewhere as you may think of us as a foundation, but Pew is actually now a 501c3 nonprofit organization. It's a public charity. And we work primarily on policy issues. We also have an arm that does research called the Pew Research Center, which is firewalled off from our policy shop. We try to focus on pragmatic and effective solutions. We seek to be as transparent as possible, and I'll talk about some of our work on food additives and how we've done that working with ILSI and working with numerous other folks in industry and the nonprofit world. And we seek to engage, as part of that transparent process, all stakeholders from all different perspectives. I'll talk about some of the projects that we've got in the food arena. I oversee our food work. And one of the projects that we work most closely with industry on is our food safety project. And specifically, that was when I came in off the Hill, one of my first assignments was to look at our food safety laws and what might be done about it. As many of you may know, FDA's food safety laws had not been significantly updated in over 70 years. And we therefore felt it was important to sit down with industry folks, sit down with nonprofit groups, and try to move forward on updating our food safety laws that FDA works with. We've also been investigating meat and poultry safety, and we don't advocate on that issue now, but we're in the process of developing a series of studies on that issue. Our role in the food safety legislation, just as an example, because this will become relevant when I talk about additives, we published a series of research publications. We developed a major advocacy campaign to push for food safety legislation. We created a coalition called the Make Our Food Safe Coalition. We entered into a very close partnership with a variety of members of the food industry. And we also established an organization at the Georgetown University, which was the Food Safety Project, the Produce Safety Project at Georgetown, to study produce issues. And among the issues, not sure where that's coming from, but among the issues that we focused on in that area, in the produce area, was specifically to look at things like water safety among produce producers, a variety of other produce-specific issues. In that work, if you can make out the list of at the top of that letter of some of the strange bedfellows, this is the kind of work we like to do. You'll see in that, and forgive me for taking my glasses off because I'm blind, you'll see that Grocery Manufacturers Association, National Association of Manufacturers, American Beverage Association signed on to the same letter with Safe Tables Our Priority, which is a victims organization, U.S. Public Interest Research Group, Consumers Union, Pew, Food Marketing Institute. It was a very broad group that allied to try to get the food safety legislation passed, and that was really, frankly, how the legislation ended up happening. If it had been one of these divisive issues and had blown up into a partisan fight, it never would have happened. And I think it was because of that close working relationship between the nonprofit community and those in industry that ultimately the legislation passed. The campaign included a variety of elements, as I mentioned. There was the Make Our Food Safe Coalition, which was primarily the public health and consumer groups. And the Grocery Manufacturers Association was very intimately involved, and we worked every day and went up and lobbied every day with GMA lobbyists and member companies. Ultimately, this was successful, as you know. Almost exactly 2 years ago, the President signed the FDA Food Safety Modernization Act on January 4th, 2011. The first major round of regulations was just proposed a couple weeks ago. It just came out in the Federal Register last week, but it was released in Word form back at the beginning of the year. And those are specifically to deal with two issues. One is produce safety, and the other is basically for processed foods. Those rules we're starting to go through, as anybody in this room knows that started to look through them. They're hundreds of pages long, and it's going to take some time to really evaluate them. A second major project is our Kids Safe and Healthful Foods project, and that specifically sought to pass the new Healthy Hunger-Free Kids Act, which specifically addresses primarily school foods. We're working on the school meal standards, which were proposed and finalized recently, are now going into effect. It's the first major overhaul of school meal standards in over 17 years. And those are a little bit wobbly because it's taken a little while to get them fully in place in some cities and some school districts, but it looks like it's moving forward. A lot of school systems are doing a great job. In fact, hundreds of them are already in compliance and are producing much healthier foods than they would have been prior to these standards. In addition, we're expecting very soon some proposed standards that will be coming out for snack foods and for beverages in schools. Those standards are required, again, under the Healthy Hunger-Free Kids Act, and we are anticipating, there were some recommendations from the Institute of Medicine. There have been a series of other recommendations to update those standards, which have not been updated since 1979. So these standards will be coming out, we expect, in proposed form sometime this year. We're hoping soon. And the last area I'll just mention is, because we've recently launched a major study in this arena, is one of the big problems a lot of schools have is they don't have the equipment and they haven't got the training in place for their staff, their cafeteria staff. So we're doing a 50-state survey of what the school systems need to do across the country in order to update and to comply with the updated standards. It's really to take a look at why it is so difficult for some school systems to really come into compliance. We're finding that a lot of schools don't even have kitchens. Many of them only have microwaves and deep fat fryers, some of them, but aren't able to prepare food otherwise. A third area that we're deeply involved in is the human health and industrial farming issue. Specifically, we're concerned about antibiotic resistance and its relationship to the heavy use of antibiotics in animal agriculture. I was surprised when I first learned about this, but about 70% of the antibiotics used in the United States are used in animal agriculture. Much of that is used to promote growth in the animals, and our concern is, and the concern of a lot of other medical associations like World Health Organization, American Medical Association, American Academy of Pediatrics, and the Infectious Disease Society of America, to name just a few. We're working with them closely to try to address this issue. We believe that there is overuse of antibiotics in animal agriculture, and we're trying to work with FDA and with folks in the industry to try to move away from the overuse, prophylactic uses it's often used, without actual known illnesses. The use to promote growth is an issue for us. The last area, and this is what the bulk I want to talk about, is our food additives project. This project is not an advocacy project. It was started, about 2.5, coming up on 3 years ago. And it was specifically supposed to look at two issues. One is to really take a deep dive, a comprehensive analysis of the regulatory program at the Food and Drug Administration, to really evaluate how is this program working. As you know, there's a law that established the Food Additives Program from 1958. And we're taking a look at how that regulatory program works, what the issues are, what the scientific issues and legal issues are with the implementation of that program. And then we're in the process of developing a series of policy recommendations specifically to the Food Additives Program. And what we'll be doing is rolling those out, I expect, in the next 3 to 6 months probably, depending on the peer-reviewed journals that we're going to. We are seeking to publish most of our work in peer-reviewed journals. We've had a very transparent process, and I'll talk about this a little more, to engage industry, academic commentators, government officials, public interest groups, to try to evaluate this program. It really, frankly, has not been seriously looked at from the outside in a comprehensive way for many, many decades. really since the so-called SCOGS program, Select Committee on Grass Substances, which President Nixon created. We have initiated a series of workshops and published a variety of articles in peer-reviewed journals. So some of the workshops that we've held, they've all been co-sponsored by the science journal Nature and by the Institute of Food Technologists, or IFT. The first one that we held was in April of 2011. That was on hazard assessment. We looked at how FDA assesses hazards from food additives, what their Red Book, as it's called, does, which is how they evaluate the science. We took a look at a wide array of issues and how the Food and Drug Administration looks at the scientific issues for hazard assessment. And the results of that workshop have now been published in a peer-reviewed journal, an IFT journal. The second major workshop we held was on exposure assessment. That also was held in 2011 in November. Again, the proceedings from this being published in an IFT peer-reviewed journal. We also did one last April, which looked at policy options. What are some of the options? So we had industry, we had FDA, we had public interest groups, academics, others propose whatever policy solutions they thought might be helpful in the food additives arena. We fleshed that out. We had debates about it. We broke up into small work groups and discussed it, and it was, I think, a really productive discussion about those issues. And the last workshop that we held was also in April, and that was on dose response, and specifically on sort of low dose and dose response issues for endocrine disruptors. That was in April 2012, and we're taking a look at all those issues as well, and many of you probably saw in the New York Times today, there was another op-ed on this issue, and one yesterday actually on the same issue. Another big set of issues that we've been wrestling with, and this is a joint project with ILSI, is to really look at the nano release issue. So specifically what we're trying to evaluate is how exactly to measure and how to look at the potential absorption and related issues for nanoparticles when they are in the food supply, or nanomaterials. And really what we're trying to do jointly with ILSI and some of the co-funders who are government co-funders and I believe private co-funders with Pew is to really take a look at those very difficult issues. We are anticipating increasing use of nanomaterials in the food supply. There are some already being used in the food supply. To really look at the variety of release issues, the absorption issues, and really to see if we can make some recommendations that would be broadly agreed to. This is a year-long effort, and we're anticipating some very productive results. I know that folks have really been rolling up their sleeves and trying to move forward with some recommendations for how we can consider these difficult scientific issues in a policymaking framework without it degenerating into a shouting match, and it sounds like so far it's worked pretty well. Got a lot of stakeholders from the nonprofit world, from industry as well as from government to really move forward with that discussion, and that to me is a pretty good example of the way that this kind of partnership can work, where you have an open process, there's not secrecy, it's transparent. You've got folks from all different perspectives that are participating in the process, and it's ongoing. It's something that doesn't get squished into too short a period, so there's really time for people to discuss and debate the issues rather than having a more secretive process. And I think that's ultimately the direction that we see it as being a productive way to try to work jointly between industry and the nonprofit community. One of the issues that we've also been wrestling with as part of our Food Additives project is the generally recognized as safe program. As many of you know, when Congress passed the law in 1958 for food additives, it basically created a couple different categories. One was that for new chemicals that are going to come on the market as being additives to the food supply, the anticipation was that the company that was going to produce it would petition the Food and Drug Administration for approval. FDA would review the safety of the chemical and would either give a green light or a red light through a public rulemaking process. That additive petition process was initially used fairly widely for a lot of chemicals, but gradually it's fallen into disuse. And what's happened is the GRAS system, generally recognized as safe system, which was originally anticipated to authorize chemicals that were sort of broadly agreed to be safe, such as vinegar and oil, or any variety, any number of other widely recognized as safe chemicals, that those would be basically approved without FDA having to spend needless resources reviewing them. But what we found is that there are actually now 10,000 chemicals or substances that are allowed to be added to the food supply, and a big chunk of those, about 3,000 of them, FDA has not reviewed or determined their safety. And there are about 1,000 that FDA doesn't know about because they're self-determined as GRAS. The companies themselves make a determination that the chemical is generally recognized as safe. And under the law, the company does not have to notify FDA of that determination. And in many cases, it's not required to be labeled because it might be, for example, a flavor, or it might otherwise be exempt. It might be something that's used in packaging that wouldn't have to be disclosed on the label. So that's an area that we're taking a very hard look at and trying to figure out, okay, how do we deal with this? A couple of the concerns that have arisen include the FDA's use of science and their current science red book, as I mentioned earlier, the way that FDA evaluates the science for safety and issues its guidance for industry. We have concerns about whether that is completely up to date and considers the most modern science. And in addition, an area that we're concerned about is very often what we're finding is decisions that were made decades ago, sometimes in the 60s, sometimes in the 70s. There isn't a systematic process for FDA to go back and take a look at those decisions that may have been made 30 or 40 years ago to reevaluate and say, okay, is there new evidence? Is there new science? Is there some way that we could systematize a look-back system? We're not suggesting that every single one of those 10,000 chemicals needs to go back through a full-blown review, but we do think that FDA needs to figure out a way to prioritize older chemicals that were reviewed and approved many, many years ago and evaluate whether they really are still considered safe. Some of the partners that we would foresee working with in trying to do those reevaluations and trying to take a look at the GRAS system and trying to take a look at whether the science is really up to date is really ILSI. We view ILSI as a strategic partner in that. We view the Grocery Manufacturers Association and many folks in industry as important partners. And of course, many of the nonprofit organizations and some of the academic experts in this arena. So we see the best way to have a real partnership to move these issues forward is to try to be both transparent and inclusive in those discussions. And we view that as the food safety model as a good model for how we can go forward with that kind of thing. And also, obviously, the Nano release project that's been pretty successful so far. Some of the areas where we see the potential for collaboration of this sort, obviously, the second phase of this Nano release effort, there will be a lot more work to be done once the first phase is complete. And we do believe that there will probably be plenty of opportunity for further discussion across the board with a variety of stakeholders. A second area that we're especially interested in, and I hinted at this, is how do we reassess all these 10,000 chemicals that are already on the market? Is there a way to set some priorities? How do you evaluate what the safety of them is, and how do you pay for that? How do you make sure FDA has the resources to do it right? And how do you make sure that the science that's being used is up to date? A third area that's very important is how scientific evidence is weighed, the weight of the evidence issue. And we know that ILSI is very interested in this. We've taken a lot of time to take a look at some of the issues of what the different approaches may be to doing a weight of the evidence evaluation. We know folks at University of California, San Francisco are spending time thinking about this. We know people at EPA have been spending time thinking about it. And this is an area where we do think it's very important to have an open discussion of how you do weight of the evidence reviews, because that really is ultimately how FDA or EPA or other government agencies have to evaluate chemicals. We're intrigued by some of the approaches that are used in Cochrane reviews and systematic reviews of that sort, but we're also curious about what some of the other models might be to really make weight of the evidence reviews rigorous and objective as possible. And another area that we're especially interested in is the conflict of interest issue. And one example of that is with grass substances. We do have concern that in many cases it appears that folks that are making the determination of safety are the same folks that are working for the companies that are producing the chemicals. And we see there as being an inherent conflict of interest in that situation. The question is, how do you open that up? How do you ensure that you don't have a conflict of interest among those who are making the decisions about safety for additives? Some of the areas for collaborative evaluation, again hinted at earlier, is really what are the strengths and the weaknesses of the regulatory system. We will be, as I said, issuing some proposed recommendations in journals of areas where we identify weaknesses in the current system and some recommendations. And as we did last April, where we held a workshop specifically to debate some of those issues, we feel that it will be important going forward to have further open discussions of those weaknesses, the strengths that people perceive, and how we could move forward. A second area that certainly that I also hinted at is this systematic review of old decisions. How do we set the priorities? This is very difficult, and I was, as was mentioned, involved in the Food Quality Protection Act reviews, where there were 10,000 tolerances that the Environmental Protection Agency was charged with reviewing within 10 years. So it was very difficult for EPA to set some sort of priority. They had a series of public meetings, they opened up the discussion at EPA, and they ended up setting up a priority system where they addressed the chemicals they had the greatest concern with first, and they had an open process of what the science was going to be that they would evaluate, and then the things that they did not feel were worthy of a huge amount of resources or attention were shepherded through the system at the end, and very often a large number of chemicals were approved all at the same time. A large number of tolerances were either approved or revoked simultaneously, depending on if the industry wanted to continue the registration for that chemical or that use. So it was a fairly systematic process, and we'd like to talk about whether there's a way to have a systematic process for FDA to go back. I think FDA's task is much more difficult, frankly, than EPA's task under pesticide law, because there's so many more uses, there's so many more chemicals, and it will be a real bear to try to wrestle with this issue, but it's very important to try to have an open discussion of what the priority setting scheme might be and how you could actually evaluate those chemicals. And obviously we believe that process needs to be transparent with a variety of public input, so it's not just one side or the other that's having that discussion, so it's an open public process. In addition, an area where we really see the need for collaborative discussion, this is something we'll be publishing an article about sometime in the next several months, is FDA science. As I mentioned, there's this select committee on grass substances that was created by President Nixon back in the 1970s. It finished with its final report, I believe, in 1982. And a lot of the findings of that select committee, it was created by FDA with outside experts. A lot of those findings still stand today, we believe, as issues that need to be addressed by FDA. There are a lot of scientific issues that have obviously changed in the last 20 or 30 years that need to be addressed. And we believe that part of the problem is going to be a lack of FDA resources on the scientific front. Certainly, many of you know about the FDA Science Board that found that there is a real need for additional resources on both on the scientific side. And I think ultimately that is a very important area for us to work with industry and with the nonprofit world to try to take another look at FDA science and update the science. I'll leave it there and look forward to questions and hearing additional comments. So thank you very much.